And this is just a reference to the NHS in England, but might be of interest, if not of immediate relevance, that government sees the NICE quality standards fitting in not just to the outcomes framework, but also into payment mechanisms as well. How that will work is currently a work in process. We've also increasingly, a couple of comments earlier about the report from Professor Appleby on NHS in Northern Ireland. It reflects some of the themes that apply to England and Wales as well. And NICE is increasingly trying to support the NHS in difficult times. If you go onto the website, you'll see an increasing number of tools which can be used locally, which we hope and believe will be of help to people. There's NICE commissioning guides, which, although some of those are specific to particular PCTs in England, can, in many ways, the advice in them be applied wherever you may be. We produce now, we've gone through the back catalogue of NICE guidance, and we start to produce do not do recommendations, guidance on when to refer and treat, and I'll come on to NHS evidence shortly. This just gives you a feel. These are the commissioning guides that NICE has produced, so it's a fairly comprehensive, not exclusive, but it's a fairly comprehensive catalogue that's available for people that can give, if you're not directly involved in commissioning, can also be used in helping to plan services as well. The do not do recommendations, this gives you a little bit of a feel for what they look like. They're bundled up into respiratory, coronary heart disease, whatever it might be, and they go through the back catalogue saying, don't do this, or do this in these circumstances, because if you do, go against the do not do, you're probably wasting resources, you're not adding to patient care. If you click on these, you get the opportunity to actually just see the recommendation in its own right, or you can see it embedded into the wider piece of guidance as well. And on some of them, we've started to cost what those savings might be. We've also gone through the back catalogue. Hopefully this is a work in progress, but will become increasingly useful to general practitioners, going through guidelines, pulling out referral criteria and trying to bundle those up together. Again, my personal view, these perhaps need to be a little bit more accessible, but it's a start in trying to make information available to either GPs themselves or GPs working in referral centres for secondary care. We also host or did host, now we're responsible for the QIP collection, and this is on NHS evidence. We inherited this from the Department of Health in England, but it is now something that we own and we run. And there are a number of what we might call national, international examples, and increasingly NICE is interested in and putting on local examples where people are looking at driving up quality, at the same time looking to save money, to keep the show on the road, to keep services delivered to patients in straitened financial times. So some good examples on there, and increasingly they're local in nature. So you'll see that if you go onto NHS evidence, you'll see at the top, you'll see QIP collection. That's something we're managing and looking to grow all the time. And again, it'd be great to get some examples from Northern Ireland. This just gives you a feel for the cost-saving page, where some of the resources that I've just mentioned to you are cost-saving guidance. This will take you through to the NHS evidence, do not do's, referral advice. So that's where you need to go if you want to know more. I won't go through this in any detail because I think I did this last time, and I'm assuming people will be fairly familiar. We produce an increasing number, what you might call nitty-gritty tools that we've produced mainly in response to what people have asked us for, rather than what we think. The educational tools that we produce are growing at about one every 2 or 3 months. We've had about 150,000 people complete those now, and some good feedback. We do costing reports, forward planner, baseline assessments for new guidance were introduced last year to complement the audit support. And increasingly we try to get out to local organisations. We're funded by the NHS in England to get out, speak to people and find out what they want and what people are doing. I will draw people's attention to the shared learning database. This has grown fairly considerably over the last year by about 50%. If you go on there now, there's about 300 examples or thereabouts of what people have done with NICE guidance. I know you'll hear from Martin later on, but Martin's got an example on there about the whole process by which NICE is managed in the Sheffield area. And there's some good examples like that. There's also good examples of what people have done with a particular piece of guidance, heart failure for example, or even particular recommendations within guidance. And we've done a little bit of follow-up, I wouldn't say kind of rigorous research, but a little bit of follow-up about what people like about the shared learning database. And what people really like is the opportunity, perhaps not surprisingly, to speak to other people in other areas about what you've done, what was it really like, what were the pitfalls. And this shared learning database enables you to do that. A lot of people have also put their work on there, which you can download, you can use if you acknowledge the authors. So we hope that's a resource that if people aren't aware of, people will look and find useful. You'll see the Shared Learning Awards just closed for this year. The NICE conference is in May. But there is an annual award, so if you are doing something that you think we ought to know about and you think other people ought to know about, we really would love to hear from you. And certainly by NHS standards, you're not going to earn a mint or win a huge sum of money, but there's a little bit of recognition, a chance to showcase your work, a chance to attend the NICE conference as well. So it might be something that will be of interest to people. And there's nothing worse sometimes than looking at a submission elsewhere and thinking, actually, we did that, and we think we did it better, but we never submitted. A little bit about NHS evidence. This is how it currently looks at the moment. You'll see at the top there the quick collection, the specialist resources. What we're trying to achieve, there's a few nods here, is we're trying to make evidence as readily accessible to people as possible. And in our mind's eye, on the one hand, we've got specialist searchers, researchers, etc., and that's great. But there's also an awful lot of practicing clinicians, managers, who have got no time at all. The kind of 10-minute searcher may not even have the specialist search skills that perhaps auditors might have. But that's okay. So we've got in our mind's eye the 10-minute searcher that hasn't got a password, hasn't got an Athens password to hand, but needs to find something. So the features of it, it's a simple search. There are accredited sources on the database. It's got a slightly Google-esque look about it. One of the many differences between Google, obviously the resources are incomparably smaller, but when you get a return on NHS evidence, you know you're looking at evidence, and that's really important, we believe, and that's one of the things that's come back. There are accredited sources of guidance. It will take you to areas beyond NICE guidance, beyond guidance that GAIN may have produced. So if you bang in diabetes, that's all I've got time for. I've got 10 minutes, I need to know something, I'm not even entirely sure what it is I'm looking for. You'll get a very, very rapid return. If anybody here has used it, I hope you'd agree. And you'll start to see, these happen to be all from NICE, the ones with the roundels, blowing your own trumpet a little bit here. That denotes a particularly high standard. People that have put themselves forward and said, we want to be accredited. And you'll get evidence-based returns, but I'm not sure what I'm looking for. So it allows you to use the navigators on the left quite quickly. Is it clinical? Is it commissioning? Is it drugs, technology? What is it that I'm after? And so it goes on. Types of information, care pathways, grey literature, clinical queries. Even you know the organisation, but you're not quite sure what the document is. So let's first search things by organisation. So we hope at this stage it's fairly flexible. And you can save things, you can save the search. If you're like me, you tend to be in a bit of a loser's loop. I tend to kind of go onto something, search, and then next week I need to find that and I have to search all over again. Some of the feedback, and I wasn't fully cognisant of this, really values the ability to save searches using my evidence. So this is roughly what it looks like. And that's great, but we'd like to take things a little bit further forward. And coming in May, we've got something which at the moment we're calling Release 4, but it's just the next step in NHS evidence. And we're going to start to bundle up. There's a number of features of Release 4. One is the increased ability to search on medicines management, so whether you're looking at the BNF and other sources at the same time to do a combined search, That's one of the things that will be there. But we're also starting to bundle things up a little bit different in terms of topics. So if you search on epilepsy, this is the kind of thing that you'll get back. You'll get the topic at the top. Your searches will still be there at the bottom, so it allows you to scroll down. But we have this thing, which at the moment, it will sound very geeky, doesn't it? We call the accordion. I'm not a kind of technical person myself, but it allows you to, is it the guideline to kind of come in and come out quite quickly? Is it the pathway that's you're interested in, give you a summary at the top? And we hope it's the next stage in making our evidence, our work, our guidance more accessible to people such as you. And it's really trying to hit those last two points that I made at the beginning of the presentation. It's got to be good quality, it's got to be relevant, it's got to be accessible, and increasingly important, it's got to be flexible to the way that people use and want guidance. So this is the next step, and I'm sure it's not the end journey. Perhaps what I would have said at the start is the NICE website is going to be updated. Probably in October there'll be a new launch of the website. It's overloaded and it doesn't stand good comparison with the NHS evidence because there's so much information, and again it's got to be accessible. And we're starting to experiment with the concept of landing pages. So on the one hand, we need to kind of carve up our guidance by condition, if you like, epilepsy, diabetes. On the other hand, there is the audience that says, I'm a GP, I work in maternity, what things might be relevant to me? I may not even know everything that is relevant. So this has been launched, this is the second. It's a landing page, so it's trying to provide practical support for general practitioners. Driven partly, I'll be honest with you, by GP Consortia in England. And we've also done another one for maternity. They're not quite prototypes, they're there to be used and they're updated, but I think they'll be taken on along with other landing pages in a little bit more sophisticated manner come the revamp of the website in October. And there's a this is the last slide. I kind of ummed and ahed about putting it in. For local organisations in England, we provide a lot of support on request, for which we don't charge. And these are some of the things that we do. You know, use of quality standards, more about evidence and pathways, actually classes on support tools, a lot of education things that we do as well. We can't at the moment do that on a kind of organisation basis in Northern Ireland, but I've put this on because for two reasons. If people are putting together larger sessions like today, or if people have got a lot of email or telephone queries, we will always do our best to support those. So whilst we may not be able to come to an individual hospital or with GP Consortia, it seems trying to grapple with the individual GP practice these days, which is quite a challenge for a national organisation. Whilst we may not be able to replicate that here, we would certainly do all we could to support perhaps slightly larger events that you do have. And certainly any queries that you may have, we're always happy to receive them. If people do want to keep up to date, there's a number of ways which are slightly contradictory in some ways, and we're trying to centralise things or unify things, should I say. So what I would say, if people are signed up to various alerts, what we're really encouraging people to do is to sign up for NICE News. The alert system will probably go later as the way of keeping up to date, both with news and also the latest guidance. There is my email details there. I hope that's been of some interest, cantering through the developments at NICE. If people do have any queries or questions, I'll be happy to answer them now or later on during the day. So thank you for listening.